What we check depends or varies on age. In a younger man in their 20s, we typically will record their blood pressure and their vital signs, their height and their weight. Hypertension can sometimes affect younger people, and it's important to find it. Hypertension has been called the silent killer, and if you don't address it, it can do damage to our body slowly over time. People today may be less active than we were generations ago, so we are seeing more obesity, physical inactivity that can lead to conditions like diabetes and elevated cholesterol. So these are the kind of things that we would be checking in a young man. Perhaps screening them for hypertension, making sure they're physically active, making sure that they're at a good healthy body weight, perhaps checking their cholesterol every 5 years or so, and then screening them for any issues that might affect their mental health, like depression, anxiety, and also for things like tobacco abuse, substance abuse, and alcohol overuse. And that would be for men at any age, but those typically would be things we would focus on when we're seeing a younger man. Men are more susceptible to things like hypertension and cardiovascular disease than women, well, especially at younger ages, although when people get to be older, say 65 years and up, women do tend to catch up with men in terms of cardiovascular disease. Obviously, things like prostate cancer are an issue in men only and not in women. Important things would be avoiding tobacco, avoiding alcohol or limiting alcohol, maintaining physical fitness over the course of the life. Regular exercise is really important, maintaining a healthy body weight, and eating a diet that's rich in fruits and vegetables and fiber and low in unsaturated and trans fats is important. Things like avoiding excess sun exposure for long-term skin cancer risk would be important, and avoiding risk factors for STDs is another important thing men should do, and staying up to date on routine vaccinations.